My name is Haley. I am an MSW student at Fordham and also one of Dr. Congress's UN students, and I have the pleasure of introducing one of my fellow colleagues and my friend, Brian Jimenez. Brian is a dedicated student pursuing his MSW at Fordham, his specialist year placement working under Dr. Congress as part of the United Nations Field Experience. Brian is passionate about creating systemic change through policy and advocacy to address social inequalities. Brian currently serves in leadership roles with several prestigious organizations, including the New York State Social Work Education Association and Psychology Coalition at the United Nations, while also managing social media accounts to increase engagement and awareness for social causes. So, without further ado, I will turn the program over to Brian.
Thank you so much. Just give me a quick second and I'll share my screen. Okay, so my presentation will be on intimate partner violence within the LGBTQIA plus community. So I kind of wanted, similar to Britta, what kind of give you a definition and what the concept of my whole entire presentation is on. And it's on intimate partner violence. Typically, when we associate with violence between partners, many people first think of domestic violence. However, we're trying to shift away from that term only because domestic violence has been linked to kind of heterosexuality or it's been linked to a marriage. However, abuse can happen in any form of relationship. And so we want to kind of encompass that and be aware of that. And so what are some types of intimate partner violence? So IPV can manifest in multiple forms, which is can be physical. So for example, hurting or attempting to hurt your partner, sexual violence, psychological aggression, what many don't talk about, economic abuse, stalking. Those are also forms of intimate partner violence. Some key characteristics are that IPV can occur between heterosexual or homosexual couples. It can affect both men and women, although women are more likely to experience IPV and have also more severe consequences of it. So I'm going to give like a little general overview of the prevalence within the LGBTQIA plus community. So the lifetime prevalence of IPV among LGBTQIA plus individuals ranges from 25% to 40%. Bisexual women report a higher rate of IPV compared to lesbian and heterosexual women, and transgender experience IPV at a rate of 31 to 50%, and gay men report a similar or higher rate of IPV compared to heterosexual men. So let's look specifically at same-sex relationships and IPV. So what are some of the unique challenges that they face and the barriers that they face as well due to their intersecting identities? So one of the common issues in research is that there's a lack of recognition and support from both LGBTQI plus and heterosexual communities. One of the and that kind of plays into the myth and misconception is that sometimes partner violence can be seen exclusively as a heterosexual issue or seen as IPV is less severe or less frequent because they're not in heterosexual relationships, or that the gender dynamics do not apply because they're in same-sex relationships. I think what's also interesting to note is that the biphobia, which, for example, a bisexual individual will be talking about having being in a male-male relationship, they may not have the same experience as a bisexual male that's in a male-female relationship. And so also right there at the prevalence rates, you can see that IPV is categorized by sexuality. So for example, bisexual women face the highest rate of IPV, while gay men face the lowest. I also specifically wanted to make a section dedicated to trans women. As a part of the LGBTQ, they are one of the most underrepresented communities. And so I felt that it's kind of like important to shed a very strong light to them. And so trans women face a higher rate of IP compared to the cisgendered individuals. And so this can be compounded due to multiple identity factors, such as disability, age, ethnicity, which we'll go into next. And so, what are some specific vulnerabilities? So, they're at a higher risk of sexual abuse. So, 22.5% of trans women reported sexual abuse. They have a higher likelihood of experiencing verbal abuse, including misgendering, identity-based ridicule, and a greater exposure to threats. And also, there's many barriers that unfortunately this community faces, which is many of them do not report the violence due to the lack of trust in police, Familial support is really important when working with trans individuals. And unfortunately, they have limited support sometimes. And then the potential denial of services due to transphobia. So going on the intersectionality, so trans women of color in IPV, so basically having the intersection of race and gender identity, so having to look at compounding discrimination and risk factors. So many of them have higher rates of intimate partner violence compared to cisgender, as previously mentioned, but compounding the aspect of race on top of that. Uh, Many of them also face the unique challenge of uh, many of our racial and ethnic minority communities have a higher stigma against sexual gender minorities, which include trans individuals. And so they may not have cultural or community support as well, on top of not having family. And so I wanted to look at kind of New York State and what resources does it have for LGBTQI plus when dealing with um, IPV. And so New York State has these are the three most well-known community resources. There's Identity House, the Center, and Colin Lord Community Health Center. So mo these are all basically services that cater to LGBTQIA plus adults, providing safe spaces or just providing services in general. However, I also wanted to go specifically over SONDA and GENDA. So SONDA is a New York State law that prohibits discrimination based on actual or perceived sexual orientation. And what I found interesting was that these laws aren't old. Like these are laws are very new. For example, Sonda only passed in 2002 and was only started to be effective in 2003. However, it protects against discrimination in employment, housing, public accommodation, education, credit and civil rights, and defines sexual orientation as heterosexuality, homosexuality, bisexuality, or asexuality, whether actual or perceived. And it added a sexual orientation to existing anti-discrimination laws in New York State. Gender, on the other hand, adds gender identity and gender expression as protected class in New York State human rights and hate crime laws. So it also allows the bans discrimination in employment, housing, and public accommodations based on gender identity and expression. And it also provides uh, enhanced penalties for bias motivated crimes. And this one only became effective on in 2019. And so what I always propose is that these advocacy organizations, such as Equality New York, the New York State LGBT Health and Human Services Network, or Empire State Pride Agenda, always try to work with them. They basically try to push for LGBTQI plus rights wherever they are, and they are amazing. I have worked with some of them before. And la I think this is my last slide, I think. That impact of IPV on the LGBTQI plus community. So, for example, they have higher rates of depression, anxiety, and PTSD, increased substance abuse, elevated risk of sexually transmitted infections, higher likelihood of suicide ideations and attempt, greater risk for obesity, increased isolation, negative mental health outcomes, disproportionate victimization rates among transgender students, and as LGBTQ plus intimate partner violence has been relatively invisible not only to the members of the community but our society in general. And so just to continue off kind of some prevention strategies, especially since we're all in uh helping profession. So having community-based approaches, so having environments to have a safe plan for LGBTQI plus youth and education. So providing LGBTQ plus specific training for service providers and providing trauma-informed LGBTQ plus services and applying that intersectional lens of gender identity, race, and so on and so forth. If you have any questions, you can also email me. Uh, and then, so thank you very much.